are back here on Healthy Living. We've been joined by Dr. Brandon Runyan along with Angie Gillespie, and we're going to talk about, again, breast health and imaging. Yes, he's my son too. I'm sorry, am I allowed to say that? I have to at least pitch you a little bit.
That's right.
So thank you for allowing me the opportunity to interview him too. It's kind of great. So let's talk a little bit about, we've been talking about breast health. We talked with Dr. Ringer, we talked with Angie about image navigating and how important that was. So we thought it would actually be interesting, Brandon, to talk to you a little bit about the actual imaging process, why it's important and how it works. We mentioned, and you suggested that maybe we talk about how you tailor your screening process to yourself and your personality. So I'm going to kind of ask you, how do we tailor it to ourselves?
And this is totally like a conversation that I have with my mom, so it feels perfectly natural. I think that screening is very important.
Okay.
It's important to understand what your risk factors are and to have an understanding of what your breast density is so that you can make appropriate decisions for your own screening process. I think what's also underestimated is people's personality. So how much they really want to know about themselves and how comfortable they are with the screening process, understanding points where they get anxious in that screening process, and understanding how to cope with that when they're designing their screening protocol.
We were just talking about that with Angie, that a lot of navigating and probably being someone who reads imaging and then talking to patients is being almost a psychologist, knowing how to approach a different person. Never thought about it.
That's
really.
right, and most of what we do is really provide reassurance. We provide reassurance for people who have breast symptoms, and we provide reassurance for people who have breast screening who are concerned about their risk factors.
Okay.
And so that's very important. I think that one of the things that screening can do well is actually provide people who have a family history reassurance on a yearly basis that things are okay. I think that with newer screening techniques like tomosynthesis, that we're able to do a much better job of screening, giving accurate answers to people, to decrease the number of callbacks, which is when people come back for further imaging, and to improve their overall screening experience over time. I also think that because we work very closely with a breast surgeon in this center, that we do a very good job of providing coordinated care to people so they don't feel like they're falling through the cracks.
Exactly, and that's exactly what we were talking about. And Angie said that you all are really collaborative, all of you within the Breast Health Center.
Mm-hmm. Yeah, the collaboration I think is a major strength of this program in particular. That is a very close working relationship, and that relationship is very important for making sure that we're following all of the protocol steps for caring for people.
So let's say that my sister had a breast cancer, and as I aged, that's information that's important for you to know, and then do you help me at that point kind of guide what I need to do?
Both our breast center and Dr. Ringer both provide information to help women understand what their risk factors are.
Okay.
We provide what's called a risk score, where we can estimate your risk based on a number of different factors.
Such as?
Family history is one.
Okay.
Breast density is another.
Okay.
History of other breast problems in the past is another.
Like a cyst or okay.
Sure. Breast of age of menarche or when periods start.
Got it.
Age when periods stop. Those are all things that go into calculating kind of an accurate risk score.
Hormones. Hormones are big too.
Okay.
And with this score, I think we can get a better estimate of what somebody's annual risk is, and then we can start to tailor what their appropriate screening for them would be. And breast density is also very important.
What does that even mean?
No two breasts are alike. Every breast is a little bit different, even on the same woman.
Okay.
And breast density is kind of a way that we score or rate the amount of dense connective tissue that's inside the breast.
Got it.
And it tends to be that the more dense breast tissue that there is, the higher the risk that there is for women, and the more important screening really is, especially annual screening. And there is an argument as to whether or not what the appropriate timeline is for screening. And definitely as you get towards the higher density breasts, it's much more important to have annual screening exams.
Does that have anything to do with my body shape or anything like that, or is it, again, if my mom had dense breast tissue, I might too?
Mm-hmm. It's surprisingly hard to predict. Some women who are quite thin can have fatty replaced breast tissue, and some people who are large can have dense breast tissue. It can be related to family history factors as well, but is not always, which is why I think it's important to tailor it just for your needs.
So one of the new things that you and I talked about was the abbreviated
Screening breast MRI.
that.
And that's a good tool for especially extremely densely, extremely dense tissue for women. And
I
that's,
mean, you were
that's-
actually excited about that. You came in like, Mom,
yeah.
this is really...
Yeah, no, I think it's a great tool. I think that for a lot of women, especially those with extremely dense breast tissue, and a family history that's kind of at a lower range,
Okay.
Where their risk score is lower, but they still have factors that limit mammography, who kind of want to do something a little extra.
Well, that's what you were saying there again, that personality.
That's where that abbreviated can come in. And you're the personality type that you want to know as much as you can.
I do.
You want that reassurance.
Yeah, knowledge.
And
I
think-
want the reassurance. It's not that I really want to know as much as I want the reassurance.
You
I
want
agree, yeah.
reassurance, right. And that, I think that's what the abbreviated breast MRI can offer.
And then once you have that, is that like a baseline and then every year you have it again?
That's a
or-
great question. So we do have the two exams. We have the full screening breast MRI, and
Okay.
then we have the abbreviated breast MRI. And the abbreviated breast MRI is really used as a tool after you've had a baseline full screening MRI. And so that's a better kind of follow-up tool. So
Got
if we
it.
think about screening in contrast to a diagnostic exam is something that we do to look for a specific problem, and in that case, you really need the full MRI. For a screening breast MRI, once you have a baseline and you want to repeat the examination, the abbreviated MRI gives you kind of a lower impact, repeatable examination that you can do year after year.
Got it. Now, that makes a lot of sense. And again, kind of pulling this full circle, coming back to you, you are there to guide me, help me navigate this system, which I'm sure can be pretty intimidating. I mean, even for me, knowing you, it's still, I would want someone to walk that process with me.
Yeah, and it's a great communication to have with your provider too. So if you receive that letter that shows that you have an increased lifetime risk, that's when you have to be vigilant and have that communication with your provider to where they can follow you closer to make sure, that we're giving you that assurance that everything is normal.
So once the screening is done and we determine whether we need to move forward with Dr. Ringer or not, then do you all still collaborate and follow up with, if it moves to the next realm, if you will?
And that's where Angie really is critical. I think one of the things we do well is collaborate with Dr. Ringer's office, but one of the things we do really well is we have Angie, who really helps to coordinate all the next step of the patient. So we really do try to take care of people at every step of the process, and that includes even after the screening exam.
Even after their screenings? So people come back to you then, obviously it's something we do yearly. Do you recommend then, if I am clean, if I have a pretty healthy mammogram year after year after year after year, is that where you start the process? We just keep doing that? Or as I age, does the protocol shift or change as to what I may or may not need?
You need to have a mammogram every
Well,
year.
no, until I'm 100.
Yes.
And honestly, the question when to start and stop a mammogram is that's one of the highly tailored things.
Okay.
Age is really just a number, and
Okay.
like we've always talked about before, there are some women who are in excellent health in their 80s, and they should consider continuing to have their mammograms. There are some women who are not in great health, and,
Okay.
and those women really should discuss with their doctor whether continuing screening is a good option for them or not.
We talked about younger women, or at what age do you begin a mammogram, or do you begin a screening process? Do you have thoughts about that?
Yeah, I think this is where it's so important to have a tailored answer to that question. Certainly there's controversy in medicine, with some groups advocating a later start time and some groups advocating beginning at age 40. I think that giving one answer to that question is not really doing it justice. Some women have risk factors that may necessitate them starting a screening protocol earlier, and some women may have fewer risk factors, and they can have a screening mammogram and maybe start later and have a different protocol. I think it's really important to talk to your doctor and to have an understanding of what your risk factors are when you're designing and setting up your risk, and something that you can do, something that you reasonably can do on a
So here's the takeaway, because you and I are big on, we got to have a takeaway, is basically tailor your screenings to your medical history, your personality, and yourself. But we know where to come. So thank you, Brandon. Thank you all for joining us here on Healthy Living. Have a safe and wonderful week. Bye-bye.